Amy? Yeah, okay, great, thank you. All right, welcome. Thank you all so much for coming to our Michigan Medicine information session. Really glad to have you here. My name is Amy Van Tyne, she, her pronouns, and I'm one of the field faculty from the Office of Field Education. My colleague, Amy Barant, is there monitoring the online group and the chat. So welcome to those in person, but also to those online. And we are recording this session, so we will plan to have this recording and the slides available by tomorrow. So welcome. Here is our agenda for this time today. We're going to be doing some introductions, and I know that I have some additional colleagues on either side of me here. We'll be introducing them partway through. All right. And then we will be talking through the Michigan Medicine field application process because it's a little different than our general field application process. So we want to speak about that really specifically. We'll talk through the placing timeline, things that you'll want to consider in terms of some of the decisions that you'd need to make about whether Michigan Medicine may be the right placement for you, or if another placement may be more appropriate based on your needs, priorities. So we'll talk through some of those expectations. Our team here will be talking about what are some specific things that Michigan Medicine offers to students with their student program, talking through a little bit more specifically about field placements that are available for winter 2026, some keys to success. We want all students to have a successful experience in field, and then we'll have time for questions and answers. So this session is intended for students that are planning to start field in winter of 26. So this is fall semester, so next semester, the winter semester. I just ask you to please hold any questions that you have until the end, because we may cover some of that content. So if a question pops up, please jot that down, put it in your note in your phone or something, because we'll definitely want to come back and answer that, but we may be going through that information as we move along. And as I said, we're doing the recording, and for those online, please select closed captioning if that would be something that would be helpful to you. All right. So just to really briefly introduce our Office of Field Education, we have a team of people. Amy Barant and I are the primary field instructors, field faculty. Sorry, we are not field instructors. We are field faculty that work with Michigan Medicine, but we have a whole team in our office, and we just like for you to be familiar with them. You may have seen some of these slides before. Erin Kong, our Director of Field Education, is in the back here. We have 2 assistant directors as well. This is our team of our administrative team. Kendra Clark is usually the first face that people see when they come into our office as our program assistant, and Sarah Castillo is our office manager. We have a placing coordinator for primarily our online program, Claire. And then all of these lovely faces are my colleagues, other field faculty within the Office of Field Education. So we just like for you to be familiar with us as an entire team. Although once you are placed, whether it's at Michigan Medicine or some other organization, you will have a field faculty identified to be working with you. And yet we all work as a team. So you will have an identified field faculty, but we always like to say if there are questions or needs that come up and your field faculty is not available and it's an urgent situation, we as a team really want to help support everybody. So please don't hesitate to reach out to our office in general. So there are a couple of really important things that we want to identify specifically with regards to Michigan Medicine information. So we're having this special information session today because we know that there generally tends to be a lot of interest in Michigan Medicine placements. And more often than not, there are more students interested in those placements than there are placements that are available at Michigan Medicine. So while we like to share that Michigan Medicine does provide amazing learning opportunities for students, and we're always excited to have students placed there, we also want you to know that placements there are not guaranteed, and that we have many other wonderful organizations that also provide great learning experiences for students. Because we usually have a high demand of students interested in Michigan Medicine, we have pushed the application process a little bit earlier so that we can start placing students at Michigan Medicine earlier, so that those students that don't get placements at Michigan Medicine can still have plenty of time to be able to actively engage in places in other organizations and field placements that would be available. So this is our early timeline. If you see more general information about field applications, you'll see that there are some different dates. But should you decide that you want to move forward in seeking a placement at Michigan Medicine, you are already attending this information session, which is today. We are going to be having an early field application for Michigan Medicine specifically. And there's an interest form that you will need to complete. It's a Google Doc that will need to be completed by September 7th. Once we have the information compiled from the Google Doc that tells us which students are interested in pursuing placements at Michigan Medicine, those students and only those students that completed that Google Doc will have their field applications opened, and that will be open on the morning of September 8th. So if you miss that September 7th deadline, you will not be able to have that early application to be applying for Michigan Medicine placements. There's a QR code we'll have, I'll share with you very shortly, but applications will then be open from that Monday, September 8th until September 11th at 11:59 p.m. So if you are wanting to apply for one of those field placements, you have to complete your application by September 11th because we will start that process then right away. General applications for all field placements opens on September 15th. So we want to get, like I said, a little bit of a head start for our Michigan Medicine placements. General field applications open September 15th. So if after this information session you decide, no, Michigan Medicine is not really exactly what I'm looking for, I'm just gonna apply through the regular field placing process, those applications will open for all students on September 15th. And the applications for those students will close on September 26th. We do want to remind you, you are only going to complete one field application. So should you decide that you want to apply early with Michigan Medicine, you submit your application. You do not submit another application when the general field application opens. Your one submission of a field placement application is all that you will need for this placing process. So here's the placing timeline. Again, we're having our session today. Your interest form will be due by September 7th. Your application will be opened on September 8th if you've completed that Google Doc, and it will be due by September 11th. Then from September 15th through the 25th, we will have, my colleague, Professor Brandt, and I will have reviewed the student materials, making sure that it seems like a good fit for the placements that you've selected, and we will be sending those materials to Michigan Medicine, to the program manager there, who will be dispersing them to the field instructors at Michigan Medicine. We are sending those materials pretty early, hopefully by the 15th, 16th, that early week. And we've asked Michigan Medicine to connect with students to be scheduling interviews. If you have not heard, if you've submitted an application and have not heard by September 25th of scheduling an interview, then we would want you to reach out to us, myself or Professor Brandt, to let us know that you haven't heard from them. Hearing from them does not mean that you've had your interview. Interviews will be held within the couple weeks after that, but we just want to make sure that things are moving forward. So we want for students to have heard and have an interview scheduled. If you go through this process, you've applied, you've interviewed even with Michigan Medicine, and at the end you have not received a placement at Michigan Medicine, then we will continue with the placing process and we'll reconnect with the field faculty that you've been working with up to that point. So here is the QR code to be able to get access to the Google Doc. I also have some paper copies if people want to take them, but it's quite the vision to see all the phones go up to check out that QR code. So this will take you to that Google Doc I was talking about where you need to express your interest. We will only be opening the field applications to those students that have completed the Google Doc. So, and again, we need that Google Doc completed by September 7th at 11:59 p.m. And then those applications will open on the morning of September 8th. And it will be due again, September 11th, 2025. All right, so having your goal statement and resume ready. There are two things that we require as part of the field application for students to complete. One is a goal statement, which is generally a 1 to 2 page written statement. And this is what is shared with the potential field instructors at Michigan Medicine or at whatever organization you're moving forward with. And this goal statement is really to help give them an idea of what your interests are and what are some of the things that you may be bringing forward and what are some of your goals. How do you do your best learning? So there are goal statement guidelines on our website, and you can reach out to the writing and skills study coordinator for any writing assistance if that's something that would be helpful. But again, just remembering that we have a very quick turnaround. So utilizing those resources on our web will be really helpful. Also, you will need to submit a resume with your goal statement, and a resume is really like any resume that maybe you already have a resume, but what you want to make sure you're doing is highlighting any social work skills, social work-like skills that you can in your resume. So please be sure on your resume that you are including your UMich email. Sometimes people like to use their other personal email, but we will be using your UMich email for this whole process. So not only is it important for you to include that on your resume, but we also want to make sure that you're checking your email regularly, at least once a day, to make sure whether it's one of us in the Office of Field Education or someone from Michigan Medicine, or again, any of the other organizations that has reached out to you, we want you to make sure that you're double checking that pretty regularly. Again, Office of Career Services has some guidelines and examples on this link here that will be available with the slides. So that's something that you can be thinking about even before your resume or before your field application opens. You can be kind of putting together that goal statement and resume. So what happens after you apply? Again, you need to apply, and then myself and Professor Brandt will be reviewing your field applications just to make sure that everything is set for us to send to Michigan Medicine. If we have any questions or concerns, we would reach out to you to talk about those things. But we then, if everything looks good, we'll be sending your materials to Michigan Medicine, and they will be reviewing your resume and goal statement. They will make a decision about whether or not they want to offer you an interview. And if so, Michigan Medicine will. This is a little different with Michigan Medicine than it often is with other organizations. Michigan Medicine will reach out to you directly to schedule those interviews. So again, really important for you to be checking your email regularly to see if you've heard from them. If you are not going to be offered an interview, they generally will let the field faculty know, and then we will communicate that to you. But if you are offered an interview, please respond and let them know that you're happy to be receiving this message, and go ahead and schedule that interview with them. At the end of the interview, if you're offered a placement with them, that's wonderful news. Congratulations. And we will finalize your placement at the School of Social Work as well. And there'll be information from Michigan Medicine that you'll need to follow up on to complete everything to be ready. But if you are not offered a placement at Michigan Medicine, that does not mean that it does not necessarily mean that you didn't interview well or that you wouldn't have been a good fit. But sometimes there are so many students for a particular placement that our field instructors are often saying, I wish I could take a couple more. So try to not be discouraged if you are not offered the placement at Michigan Medicine. But again, the field faculty will connect with you about what next steps we'll take, whether it might be another placement at Michigan Medicine or somewhere else. So some things that we want to make sure that you consider. Again, Michigan Medicine placements are not guaranteed. So as you're looking, when your field application opens, look kind of broadly at what the opportunities may be, and think about what other things may be matching what your interests are. Another thing to keep in mind is that all Michigan Medicine placements are being filled at the same time. So on your field application, you'll have the opportunity to rank 3 choices. What are your top 3 choices of where you would like to be placed? It doesn't mean that you're going to be placed at one of those top 3, but it gives us an indication of what your strongest interests are. It's really important for you to diversify your application selections, because if you put 3 Michigan Medicine placements that tend to be particularly in the interpersonal practice pathway, if you put 3 that are all IP, so let's say you put outpatient adult psychiatry, outpatient pediatric adolescent psychiatry, and a partial hospitalization program, all 3 of those you'll rank them 1, 2, 3. Other students will have ranked them also 1, 2, 3. Other students, the ones that you put 2 and 3, will have put them as their number 1. And so those students are going to be sent there first, which means likely someone's going to get placed there. And if you don't get your top choice, your second and third choice you've ranked have already been taken by somebody else. So to really be thinking about diversifying your placement interests, to not only select Michigan Medicine placements. However, if you're really passionate about being at Michigan Medicine and you want to really pursue that heavily, you may want to consider some of our more macro, that have a blend of macro and IP experiences that I think my colleague David will be talking about here shortly. So again, thinking about diversifying your application selections a little bit. Placements at Michigan Medicine are 24 hours a week. There are very minor exemptions from that. If people have a question about that, that's something that we could talk about. But generally speaking, across the board placements are 24 hours a week for 3 semesters and 3 consecutive semesters. So that for most people means that you're going to be using some of your elective credits to complete the number of field hours that are required at Michigan Medicine. It's a very, very common thing. We have many students placed there often. And so using some elective credits for additional field hours is very common, very normal. But it is something for you to be considering. That will limit how many elective credits you can take in other kinds of classes. You also would need to complete an out-of-sequence petition to account because this is a more unique schedule, and that's something that we will give you more instruction about should you be placed at Michigan Medicine, but there is some documentation that would need to be completed. Again, placements are 3 consecutive semesters. So if you are starting in the winter semester, that means you would need to be in field winter, the spring summer semester, and the fall semester. So generally speaking, students are in the 16-month track that these placements work for. If you are a student in the 20-month track and you are really interested in Michigan Medicine, we have sometimes students that will switch from the 20-month track to 16 because they want to be, based on where they want to be placed. And so that is definitely an option. What I always want to encourage students to do is don't make a change now. Move forward with the field application process. Make a note in your field application that you are 20-month, but you would be willing to move to 16-month should you be placed at Michigan Medicine. That gives me and Professor Brandt the okay. They know this. They know that we need to move forward. They would know that they would need to make that change should they be placed there. So don't make that change now. We want to make sure that you get that placement first, and then you can make that change. Should you not be placed at Michigan Medicine, we don't want you to be bopping back and forth between different schedules that you have. So something to keep in mind. Students will participate in the student program that David will be talking about here shortly. It's important to remember that there's not flexibility around the schedule of the student program. So Thursday mornings are when the student program meets in the winter and spring summer semesters, and Tuesday mornings in the fall semester. So students would have to make sure that they can attend the student program in those semesters. There's also 1 additional elective credit that students in all healthcare-based placements, not just Michigan Medicine, but all healthcare-based placements need to take, which happens in the winter semester. It's a 1 credit interprofessional practice class that is a supplement to the learning that you'd be taking not only in your classes here, but at the health center as well. So those are some expectations to be considering as you're making some decisions. And I would like to hand this over to my colleague, David Fulkerson, who's the manager over several things at Michigan Medicine, but one of them is the student program. And he will introduce our field instructors from Michigan Medicine as well.
Good afternoon, everybody. My name is David Fulkerson. My pronouns are he, him. And like Amy said, I am the program director for the field education program. And then Melinda Dobine is the program manager for the field education program. She fell sick and could not make it today, but she is the person that runs the day-to-day aspects of the program and would be the person that would be your kind of continuous contact outside of your field instructor. So I know that, well, I imagine you might be feeling a little bit overwhelmed, maybe a little discouraged after all of that. I was in your shoes, although we were meeting downstairs instead of this nice room when I went to this informational session as an intern 10 years ago, when I was interested in a Michigan Medicine internship. And I was feeling similarly, where it felt like a lot of hoops to jump through. And I applied and I was successful, and it was an incredible experience, and I'm still working there. So I think for the most part, it worked out. But I am going to talk a little bit more in detail, and then we have some of our field instructors to talk in more detail about specific placements. And we have a student who is actually an exception to some of the rules that Amy gave, but we won't talk about that. So yeah, what do we offer? So the placements at Michigan Medicine offer an array of didactic and hands-on experiential learning opportunities, much like many other placements. What we do, though, is we offer a pretty wide range of interpersonal experiences, interpersonal practice, both micro. We're adding more and more macro placement opportunities every year. We find that it's challenging to match students to those macro placements. So if you have any interest in program development in a healthcare setting, please consider us for that. But most importantly, our field instructors are the best. We believe that very strongly. They're top of the line instructors. They have years of experience. Collectively, we have several decades of experience spanning psychotherapy, case management, private medical, mental health, public health, research, management, and leadership experience. And we offer that in that one-on-one relationship between field instructor and intern. For the weekly mentorship courses and weekly workshops and seminars, as Amy discussed those in the winter and spring and summer semesters, that would be your Thursday morning, where the entire cohort comes together. And first half of the morning, you have a mentorship that is I think an 8-week mentorship. So some of those mentorships, so you would have 3 mentorships through the course of your experience with us. Some of them are macro based, like health equity work. Some of them are interpersonal. So a specific psychotherapy modality like CBT for anxiety or dialectical behavioral therapy, or working in a palliative care environment. And then you get to choose your second and third mentorship. Your field instructor chooses the first one for you. And those are small group experiences, and you're going to be not working with patients in those mentorships, but you might be observing your instructor work with patients, and you'll be in live patient care areas for some of them. And then the second half of the morning would be seminars and really more of a didactic experience on a range of topics, from psychopharmacology to intersectionality of social justice, racism in healthcare, health equity, different social determinants of health, working with in the child welfare system, child protection, mandated reporting, et cetera. And that goes for the entire year as well. We also have the clinical skills training series, which are sort of 2 different placements outside of your individual experience with your supervisor, where you again will be in a small group setting, in a clinical setting. So you get 2 of these. I think they're 6 weeks. One is in a psychiatric setting and one is in a medical setting. And so you're doing a live assessment with actual patients who are prepared. They know that you're a student. They know that you're coming in that day. But the supervisor, the social worker on that floor works with you, supports you in walking into a room, meeting a patient, and assessing that patient and going through the entire process of doing a psychosocial evaluation with a small group of your fellow students. And then you take turns through that 6 weeks of doing each individual part of that assessment. We also have interprofessional educational experiences. So we partner with the School of Pharmacy, the medical school, and the School of Nursing to cross-train in some ways. We have social justice grand rounds. So if you are of a mind to stretch your public speaking skills, you have an experience in clinic, where you have a case that's really interesting that might be a good teaching opportunity or a learning opportunity for your peers and for the rest of the social work department. You would have the opportunity to apply to present. Each semester, we have one social justice grand rounds. So you get to apply to present as a student presenter to the entire Department of Social Work as that presenter on that case. You get to have a panel of experts for a Q&A session with discussion. It's a very exciting opportunity if you like that challenge. And then we also have an IPE, an interprofessional education social justice grand round with the School of Pharmacy. And then in the winter semester, we have an additional All Women Are Leaders section of that social justice grand rounds, which focuses on women in leadership in healthcare. Okay, so I'm gonna start turning it over to our individual field instructors to talk about the different sections. Anya?
So hi, my name is Danielle Morano. I use she, her pronouns, and I have been a social worker at Michigan Medicine for almost 18 years now. It's been a minute. And I've had students for probably 17 of those 18 years. So it's always one of my favorite times of the year when I get a new student, and I'm hoping that I will be seeing some of you at interviews later on this month. So we have two departments at Michigan Medicine that primarily employ social workers. One is the Department of Social Work, and the other one is the Department of Care Management. And I have been the representative on the Student Education Council for the Department of Care Management. So what is the difference? The Department of Social Work has the social workers that do a lot of ambulatory care, outpatient mental health, inpatient mental health, inpatient consult services, where the Department of Care Management, we are the ones that do all of the inpatient unit-based social work. So when you think about inpatient medical social work, what do you think of? First of all, I want to stress that we are a clinical placement. Our social workers work with patients experiencing mental health, substance use disorder, people who are unhoused, people who need support and resources. We do assessments of patients who come into the hospital and screen positive for suicide or any suicidal ideation, people who screen positive for interpersonal violence or any violence in their lives, as well as people who screen positive for needing assistance with things like housing, transportation, food insecurity. So we have a very broad range of things in the hospital that we see patients for. I think one of the biggest differences between inpatient social work and outpatient social work is that patients in the outpatient arena are often have some buy-in into the fact that they're seeing a social worker. That may be a choice that they made. They may be mandated by somebody in their life or by a law enforcement agency to see a social worker, but they're choosing to be there for one reason or another. Where inpatient, we're often sent into patients' rooms and they don't necessarily want us there. In fact, they may not be happy about our presence at all. So that really forces us to use our engagement and intervention and assessment skills in very different ways. And we can get pretty creative about how to do that. So we do some discharge planning. The inpatient social workers take responsibility for discharge plans that are considered to be more psychosocial. So that includes hospice, end of life, memory care placements, and long-term care placements, as well as adult foster care. That means we sometimes have to interface with the community mental health system and other community agencies like Adult Protective Services. So we function as a very close member of the interdisciplinary team. We work with our physician partners, we work with nurses, we work with physical and occupational therapy, we work with our dietitians. Pretty much any healthcare discipline you can think of, we partner with them for patient care. We are unit-based, which means that each unit in both the adult hospital and the children's hospital have their own assigned social worker, and our caseload consists of the patients who are bedded on that unit. There is going to be some moving and shifting because we are opening a new hospital in November. So those of you starting in the winter are going to be in a little bit of a different landscape than what we're used to. A lot of us are changing assignments. Some of our patients are changing locations. So you'll really get a feel for what this looks like in a dynamic healthcare system. We also have social workers that staff the emergency department 24/7, and our inpatient units are staffed from 8 a.m. until midnight. And we have an evening shift of social workers that staff the inpatient units after hours. So that does open up the opportunity for students to get some after hours placements as well. I'm not sure what we have field placement instructor wise, but there are preceptorships as well. The caseload and patient population is going to vary greatly by the unit that you're placed on. So we have placements in cardiology. I work in bone marrow transplant, neurology, general medicine, general surgery, lots of different exposure. And many of the units have mixed patient populations. So you might not be seeing patients that are from one disease category together. Trying to think. So our assessments that we do are a little more focused, that are to the need of the patient and the reason why we're being asked to see them by the team. We learn that it's amazing how much information you can get from somebody in 5 or 10 minutes, especially if they just blurt it all out for you. So we don't necessarily do a structured biopsychosocial assessment the way that folks do in other more traditional mental health settings, but we do get pretty much all the information that we need to know, and sometimes a lot we don't need to know. And then we provide social work intervention throughout the patient's hospital stay, which means we'll follow the patient from the time they're admitted until the time they're discharged. And again, the intervention really is determined based on the need. Some patients need assistance with medical decision-making. Some patients, we may need to be working with community partners or families on guardianship and placement. Some patients need support and resources for, again, interpersonal violence or mental health issues. So we do a lot of that work. So if you have questions about any of that, I'm happy to answer them afterwards, and I'll turn it over to whoever's next. Oh, I covered a lot of this, but I forgot I had a second slide. So you'll see this is a pretty long list. When I walk into a patient room and I'm trying to explain my role to them, I pretty much say it's everything in the kitchen sink. Anything that's not a medical question or concern is often something that's brought to the inpatient social worker. We get some really interesting questions. Some really interesting problems. One of our referrals that came to us was a patient whose power wheelchair was broken, and he needs his power wheelchair. That's how he gets around. So what do we do about a wheelchair that's broken when the insurance company says, too bad, so sad, we already gave you a wheelchair? So gen medicine, general medicine units, substance use, mental health, unhoused, home safety concerns, IPV, behavioral concerns, and our common social work facilitated discharge plans, our hospice care, long-term care, memory care, group home and homeless shelters, surgery and specialty units, neuro, otolaryngology, cardiac surgery, ortho trauma, hemonc, pulmonary, transplant. And that brings us to adult ambulatory psychiatry. So I covered that a lot really fast. I'm happy to answer questions.
Hey, I'm Martin Hegestad, and I am a social worker in the adult ambulatory clinic. We don't have anyone from child or UMass, so why don't I say a little bit about all three of the areas? So can you all hear me okay? We are located at the Rachel Upjohn Building, so that's up in the northeastern corner of Ann Arbor. And so there are several clinics there in the building. There's the adult clinic, child adolescents, and the addiction treatment services. And we are going to be offering psychotherapy placements in all three of these areas. They are, I think, among the best psychotherapy placements that you'll find through the School of Social Work. So these are really great paths to pursue for people who have a specific career goal as social workers to train as psychotherapists. You will get some really excellent opportunities in our setting. Typically, this would include being paired with a social worker from a particular team, a particular interest area. On the child side, this might be anxiety, for example, or mood disorders. On the adult side, it could be depression, anxiety. I myself am on the perinatal and reproductive psychiatry team. And then, of course, there are the addiction treatment placements as well. You would typically have a weekly new patient assessment that you would do together with your field instructor and possibly with a physician as well. And that is a really intensive assessment, can take up to 2 hours or more, really doing a complete biopsychosocial spiritual assessment. You would be then afterwards attending an interdisciplinary team meeting where the new patients are being discussed and where there are educational opportunities together with trainees from psychology, from medicine, from other fields. And then you would also have the opportunity to pick up your own caseload. So to see could be up to 5 patients per week for individual psychotherapy. That is all observed by your field instructor. And so you get like real-time input from the field instructor. If it's a Zoom therapy session, you could get input through the chat feature, for example, while you're working with the patient. And then afterwards, you get about an hour of supervision per week. And so a lot of opportunity for very personal mentoring in the craft of psychotherapy. There are also lots of other opportunities that go along with being in ambulatory psychiatry. You can sit in on other teams, watch other assessments and in other areas of the clinic, even sit in on therapy sessions, as well as all the very rich opportunities that you have across the health system. Trying to think if there's anything else that I should specifically. Yeah, you would have the opportunity to learn different modalities of psychotherapy. So cognitive behavioral therapy, we have a strong dialectical behavior therapy program in both adult and child, and interpersonal psychotherapy, child-parent psychotherapy, and also brief psychodynamic therapy. My own interest is more in the psychodynamic therapy end of things. I've been in ambulatory psychiatry for 20 years now. I actually did my internship there exactly 20 years ago and just never left. We have the opportunity after completing the 1-year internship, we offer several 2-year postgraduate fellowships in psychotherapy. These are really a unique and really powerful opportunity to build psychotherapy skills after the MSW. There are only a few fellowship programs like this in the entire country. I went through that program as well many years ago now, and I've been a field instructor through the school here and also a clinical supervisor in that program also. And we do have a whole team of really great, highly experienced supervisors who are really excellent therapists, really thoughtful people across all of these different clinic areas. So I'm happy to talk with anyone who might have more questions about what we offer.
You wanna- Okay. Better than I could.
Sure. So my name is Chris Adams, he, him pronouns. I'm a social worker on the partial unit, which is located directly next to our 9C inpatient unit. So an inpatient, as you can see, there's a lot of areas that overlap, like a lot of social work. We're doing biopsychosocial assessments, brief therapeutic interventions. So it could be anything from like, obtaining care for people, like outpatient treatment. It's like working with people, kind of tackling whatever needs might be met in an inpatient setting. Sometimes it's different types of resources, financial or like materials. That'd be like clothing, something like that for our patients in need. It's an interdisciplinary team. Their team meetings are every day, Monday through Friday. It's usually about a half-hour meeting or so, and it's a combination of social work, nursing, leadership, activity therapists, psychiatrists, and residents and medical students. So it's a kind of a big. Those are bigger teams, and social work is an important part of that. Kind of like giving updates. One of social workers' primary functions on the inpatient unit is to do a lot of like family collateral information or like discussing care with families and then bringing that back to the team to kind of help establish a robust discharge planning. So that's part of that. Facilitation of mental health court. That is a big part of inpatient work, is anyone that has been involuntarily hospitalized. If they don't sign in voluntarily, part of what social workers' function is to meet with patients, give them the opportunity, help connect them with the mental health court of Washtenaw County. So that is the primary part. So that kind of gets that ball rolling. So stuff gets faxed. Our job is to fax stuff over to the courts, make sure they get an attorney set up to represent them, and then go to the mental health court, which I believe are Tuesday mornings. So that's our inpatient unit. Oh, okay. So I work on our inpatient, on our partial hospitalization program on 9D. So we are directly next door to them. So a big part of what we do in partial is we run groups. So I like to stress that because I don't want anyone to be surprised. If you are interested in partial, we are group-based. So we are in outpatient service on the medical campus. And it is a Monday through Friday. So it's 10 business days in length. We primarily, as social work, we are responsible for running our processing groups. So we facilitate those. That kind of looks like, as people are going through our program, we use a combination of dialectical behavior therapy and cognitive behavior therapy. And so as patients are coming, part of a social worker's job in that morning is to kind of see how patients are doing, how they're incorporating skills, how they're like any barriers to doing that. And kind of just kind of going through those skills on a more somewhat of a one-on-one, but also in a group-based way. We also provide family meetings. So anyone that feels like that would benefit to them, sometimes people need help kind of like discussing their diagnoses or treatment with family members. Or there's any kind of barriers or anything that we can kind of help adjust in that family system as people are coming, kind of being plucked out of that family system and then being dropped back in. So part of what we do is kind of like meet with families and see if there's anything that we can do to kind of bring about any kind of change to that family system. Like I was saying, it's 10 days. Our caseload kind of varies. I think it's at most to be 16. So social work, besides doing our processing group, we are also responsible for doing a psychoed group. So what that looks like kind of varies on whatever your interest is. So I personally am interested in like acceptance and commitment therapy. So I do like some groups with ACT. I do a little more like robust teaching with cognitive behavioral therapy. These are interest of mine. So I kind of create that and run groups based on that. And then outside of that, social work, we are also responsible for carrying a caseload. So outside of doing our processing groups and psychoed groups, we carry anywhere between, I'd say, 3 to 5 individual patients. And in that time, we also do a brief supportive therapy. So we're not getting into like really long-standing issues, however, kind of more like what's going on in the moment. Are there any of the skills that are being taught in programming? So any of those CBT, DBT skills that can be helpful in that moment. As they go through the 10-day program. And then anyone who doesn't have outpatient providers, it's a goal of ours is to, we need to get people set up with community supports, whether it be psychiatry or therapy. And if I have any questions, I'm happy to answer any.
Martin talked a bit about child and adolescent psychiatry. So I will go through that. And you, Mats? And then this is just a little bit about some of our hybrid and macro opportunities. So we have a placement in comprehensive gender services. That was actually my placement. And I'm very excited that for the first year, actually since I was there, we are offering a placement there. And it wasn't my fault, I swear. It just hasn't been possible. So that is our adult program for providing mental health and case management services for adults seeking gender affirming care here at Michigan Medicine. We also have placements in the Michigan Institute for Clinical and Health Research, at the Turner Senior Wellness and the Silver Club programs if you're interested in working in with elderly folks in geriatric programs. We have one placement at the School of Dentistry, which is a really interesting space, a very new space for social work to be. We didn't really know the dental school and dental profession didn't really fully understand or realize the potential of social work support in dental spaces. And so there's some exciting kind of ground floor work being done in that space. And then we also, the placement with myself and one of my colleagues in the palliative care is the one at the bottom there, in palliative care, working with adults and social work administration. That would be my part. So these offer unique opportunities for students looking to gain experiences in areas of social work, research, education, administration, program development, and you really will get an opportunity to do that work. It's not just, kind of scut work, it's program development. You will be working closely with your supervisor in doing that work and getting your hands dirty in that process. Some keys to success. We're looking for people who are committed to learning. We're looking for people who are looking for a diverse educational experience. We talked about what an individual placement is going to look like, but I've also talked about all of the different opportunities. So that really does give you an opportunity if you look for it, if you take advantage of it, a lot of diversity in what you will get. Social work is an exciting field because there are so many ways that you can be a social worker. It can be kind of overwhelming as a student, picking and choosing the opportunities and deciding what path is the right one for you. And so we offer the experience of we offer that diverse experience and hopefully the support to help you navigate that experience successfully. We are looking for folks who are flexible and have the ability to adapt because healthcare, especially inpatient, I'm sorry, strike that. All of healthcare requires a lot of adaptability. You never know what you're going to encounter on a day-to-day, on an hourly basis. Professionalism is extremely important. I never understood fully how much care I would take in writing an email. It's an interesting part of my job. Regular and open communication with your field instructor, communication, asking questions, very important. And then an openness to new experiences and being willing to challenge yourself. This will be a challenging internship, but it will be a well-supported internship. And so we hope that you will consider us, and we're now here to answer any questions that you might have. Thank you.
Thank you all so much. We do have a student here to be able to help answer some questions as well. And I just want to take a step back because I know in the beginning I was like, here are the timelines, here are the things, da 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 da. But I also want to say, Michigan Medicine is a wonderful training program for students. In addition to individual field placements, the student program is really, really exceptional. And so there should be a lot of excitement and eagerness in wanting to be a part of that. I was a social worker at Michigan Medicine for 23 years. A lot of that time I spent having students in field placements with me in a number of different settings, doing both interpersonal practice as well as more macro placements. And so students do have really wonderful experiences. And I don't want, when people hear that this is a high demand placement area in terms of like lots of interest, lots of students applying. I don't want that to discourage you from applying if you feel like this is the place, because why wouldn't, you may get that placement. So want to really encourage you to do that. I also would really want to encourage you to make sure, if you haven't already, to watch the other webinar that we posted around general hospital-based placements, because we covered some information as well. I know you heard a lot of detail around some different placements, but we are also covering some of that more content. I think, like Danielle talked about, that in a medical setting, we're still doing clinical work, and that is true. It's just being done in a different way than you would do in an outpatient mental health psychiatry area. So being able to get a little bit more of that general information will probably be helpful also. But Leo, did you want to share anything with the students before we open up for questions? You have to hold that button, I think.
All right. Hi, guys. Hopefully y'all can hear me online too. My name is Leo. I am a student in the Michigan Medicine Field Placement Program. I started last year, so a year ago. I was in your very seats right now. And then I started this year then, in January. And my current field placement is one of the more macro ones. I'm part of a consultative service at the hospital. So essentially, we get consultation requests from doctors and patients who feel as if there might be discrimination or bias impacting their care in whatever way. And then once we receive that request, we meet with either the patient or really, it's whoever did the consult request, which could be a patient or a provider. And we do a lot of bridging the communication gaps between patients who are experiencing discrimination or bias in their care and the care teams that might be sort of allowing it to happen or potentially contributing to it. Now, I don't want to say that Michigan Medicine is full of that. I think it's very cool that we have a consultative service that is able to address that, because as we all know, sometimes that happens in healthcare. So I think it's really proactive of the hospital to be able to have that service to address it head on. But yeah, anyway, the reason I'm here is because something that I think is very new as part of the field placement program are student-led committees. And it literally just opened up a month ago for students who are at Michigan Medicine to join. And so I joined the Prospective Students Committee. And basically, I'm acting as a consultant or liaison to any people who might be interested in potentially getting their field placement at Michigan Medicine. So if you have any questions about how the experience has been, you can definitely ask me. I will also I'll walk over to the person moderating the online version of this, and I can put in my email before I head out. So yeah, thanks.
Great, thank you so much. All right, we would love to open it to questions. So, but I'm wondering, just for our online, we'll need to send the microphone. So.
I have two, but I'll start. How many field placements are there within Michigan Medicine? Are you allowed to share?
So how many are being offered for the winter semester? I would say it's about 15 or 16. So some of the things that were covered here, when students are placed at Michigan Medicine, some of the placements that were listed specifically are going to be offered for the winter semester. Others may not have their own placement, but students will often have access to be doing preceptorships in other places as well. So if there was a particular area like, oh, that's so exciting, I'd really like to do that, it may be that when you see our placing dashboard, when you have your field application, that specific placement may not be offered for the winter semester, but should you be placed at Michigan Medicine, you may still have access to have some experience there. A preceptorship means that you're spending some time with that social worker on that unit. It may be a few hours, it could be up to a couple of weeks. That varies. It's usually in a second and third semester that students do preceptorships.
My second question is about the 16 versus 20 month program. Could you stay in the 20 month and still do the 3 consecutive semesters and just not do the last semester of field, or extend it to 4 semesters? Or is it really you have to switch to 16?
You really have to switch, because you have to be a registered student for the semester. So you can't only be in your field placement over a semester if that's not part of your curriculum plan. So you would have to make that switch. Like I said, there are very, very few exceptions to that. Generally, if there would be any exceptions, it would be more in the macro placements that are listed. So what I would say is we need to have a conversation if that's something that's absolutely needed. You may have also noticed, and when David was talking about some of those hybrid or macro placements, there's a mix of more interpersonal practice along with macro. I know I had students with me in what would be considered a more macro placement, but many times the students that I worked with were having direct interactions with patients and families, in addition to working on programmatic things and policies for the hospital and things like that. So those hybrid or mixes are often available to students that are not in the macro pathways, that are more in interpersonal practice or children, family, and youth. Those more macro placements may be a good fit for some of your interests. But you'd have to know that it's a mix of things. Yeah. Other questions?
Yeah,
great.
I got the microphone. I have two questions. One, are there any field placements in like infectious disease or HIV primary care?
We don't have any, so I have the list. The program manager is sick, as I think David had said. So I have the list that she sent me. We don't have anything specific as a placement there. However, as I was saying, with preceptorships, there could potentially be opportunity to have some exposure to those areas. One of the other things to keep in mind that we try to talk about generally with field placements is that where you are placed does not indicate that that's what you'll be doing for your first position after you're done with your program. It's really about building the competencies and skills of all MSW students. So you may have a particular interest with a particular patient population or medical service, and that's great. And maybe there will be a placement and it'll be a great fit. But if that's not the case, you still can be building the same skills and competencies that you would be needing to do for that job that you're hoping to get after you graduate. I had a student that she was so certain that she really, really, really needed to be in a neonatal care intensive care unit when she was doing her field placement. And that was not an option that semester. And we had a lot of conversation. I told her I had been a NICU social worker, and I knew that the skills that she would be building in one of these other placements would absolutely translate to where she was. And then she got a field placement working in oncology, and she absolutely fell in love with what she was doing. Also, she's like, I can't even imagine not doing oncology social work. So sometimes we also think we know exactly what we want to do, but it's great when we can get exposure to other things because we find out interests that we may not have understood before that too. So not a specific placement, but there potentially could be exposure to that.
Okay, awesome, thank you. And
Yeah.
I'm here to expand my mind, so good deal. But my second question is, I'm in the Detroit Scholars Program, which is, specialized clinical training. Does that exclude me from participating? We do have like something set up on not every Thursday, but on some Thursdays related to that like specialized training. So just trying to understand how that works.
Yes, unfortunately, the Detroit Scholars Program has some specific criteria that placements need to meet, and I do not believe that the placements at Michigan Medicine will meet that
Okay.
for that particular scholarship.
Okay.
Yeah,
All right.
Yeah.
Thank you.
yeah, sorry.
Do you mind if I ask one real quick? I was wondering if we could have a little bit more information about the macro programs, specifically with the older adults one and what it would look like to work on that unit or in those places like day to day.
I would say, oh, do you know? Okay, I would say, so, yeah, so that's one of the placements that Amy Brandt is the field faculty for, so.
I love that question. So for older adult pathway, I have to tell you, so I'm going to have two spots. I'm going to have Turner Wellness, fantastic, and Silver Club Memory Care. We'll have just two slots, one in each. They are both very interpersonal practice, and honestly, I'm biased, but two of my favorite spots, really warm, knowledgeable, excellent field instructors. So if that's of interest to you, maybe come up and talk to me after. But I have nothing but great things to say about both those programs.
Thanks.
So she could talk with you a little bit more about what experiences students have had, the kinds of things they're doing, if you want to talk with her after. Yeah.
Hi, thanks so much for the session. can anyone speak to what Michigan Medicine is looking for when they decide whether to offer an interview? And does that differ based on the opportunity? Are they looking for particular experience, relevant experience, or anything else that you can share that might be helpful for us to know?
I would say that it depends on the placement. So factors, some of the factors would be, if there is relevant experience, that would definitely be a positive. If it matches your interest, so each instructor, each placement is going to be looking for something in that a good fit. Okay. And so a lot of that is subjective, a lot of that is objective. I would say that, so for my placement, I was looking for, because it is a split placement, 50% is interpersonal practice and 50% is macro administrative. That's kind of a Goldilocks. Yeah, is that the right fairy tale? I was looking for a kind of, I thought I was going to have a hard time finding a student for that because it feels like a Goldilocks sort of situation, like who would want that experience? But really, like Amy was saying, there's also a lot of diversity in terms of what you're going to experience and what you're bringing to that experience as a student. So we try to, I think we all recognize that. And so we're looking for a student who is motivated and interested, I think, more than anything. If you want to work with kids and it's a placement in pediatrics or with child and adolescent psychiatry, and we recognize that that's what you want to do, then we're going to be inclined to offer you that position. If you are qualified, if you had relevant experience, that's a bonus. And if there are 3 people who apply for that placement and you're all excellent candidates and someone has relevant experience in between their bachelor's and their master's, that might be the reason that person got it and you didn't. But I guess, does anyone else have any?
Hi, I'm Latrice. I'll introduce myself, by the way. I'm Latrice. I'm the Children and Women's Bereavement Program Manager with the Office of Decedent Affairs. So all matters related to anyone who's experienced the loss of a pregnancy or a loss of a child. And then we have the adult side. So that's a little bit about who we are. Now, in terms of what a field instructor might be looking for me, I know, is someone who exhibits a willingness to learn, right? To be able to be in a learner posture, if you will. Certainly having experiences and strengths in certain areas is definitely welcome, but there are things that we can teach and train along the process, right? That's what the field placement is about, is that you're in a learning mode. And so someone who really has an openness to learn, I would add to that. Can I take a liberty to say something else to
You can I add something more too? I'd just like to add a little also. The field instructors know that you're students. So while if you have some relevant experience, that's great to be able to highlight that. It's not a requirement. Like David said, if there are multiple students for one placement, yes, someone with some experience may edge somebody else out who also might have been a really great candidate. But people know, as Latrice was just emphasizing, that the goal is really about being a learner. And so being able to really show that, demonstrate that interest is most important. Being able to express why you're interested in healthcare in general, I think wanting to understand that you have a real desire to be in that kind of environment. The other thing that I would say I would caution people is sometimes they have an interest in working in healthcare because they've had very personal experiences in healthcare. And while that is incredibly important and a part of who you are, sometimes that can be expressed in a way that could draw concern from potential field instructors. With raising questions about, are they ready to be in this environment as a provider of service when there's such an attachment to what's happened in their personal lives? So I'm not at all suggesting that personal experiences cannot be incredibly important in kind of the drive for why people want to do this. But if you emphasize a personal experience very heavily on a goal statement, that could raise some concern with people wondering, are they really ready to be in this role at this time? So that would just be something that I would just consider as you're writing things. So yes, you want to add something?
So the only other thing that I wanted to kind of highlight was number one, to say how great it is that you're walking into the best profession ever, right? Social work. Yay, right? I feel like I'm the salesperson to close the deal. And just to be able to appreciate that your journey can zigzag. When I was applying to be, and I attended Michigan State for undergrad, go green, go white, and then Michigan for grad school. And then when I applied, my goal statement, I said that I wanted to open a home for teen moms, because that's where I had worked. Where I ended up being placed, the first placement, because I did the 20-month track, was related to that. My second one was totally different. It was at the Sexual Assault Prevention Awareness Center here on campus. Totally changed the trajectory of my career. I then moved over to the hospital to do intimate partner violence work. Then from there, transitioned into OB. And then from there, transitioned to where I am now, which is working, like I said, with the Office of Decedent Affairs. So your path can take different turns, and just know that your skills are transferable, as Amy mentioned earlier. So just don't wedge yourself to one thing. This is what I've come to school for. This is what I'm intending to do, but be open. So.
Yeah, very well said. And I do know we're past time, so you're welcome to stay or step out. You won't be rude if you need to step out. We had another question.
Thank you. I'll stand so I can see you guys. I have two questions. One might be a little specific, so if you don't have an answer for me, that's okay. But for the child and adolescent psychology placements, psychiatry placements, is that more adolescent interpersonal practice? Does it vary? Are you really getting like 4 or 5-year-olds all the way up to 18-year-olds? Can anyone speak to that?
It depends on the supervisor. So some supervisors, some social workers in child and adolescent psychiatry tend to work more with younger kiddos, and some tend to work with older adolescents. So what I didn't say earlier is that I started my career in psychiatry after my internship. I was a fellow like Martin, but I was on the child and adolescent side. When you're a fellow, you get 2 supervisors, and one of my supervisors only pretty much exclusively worked with older teenagers, and the other one worked almost exclusively with younger kiddos. And I chose them kind of intentionally because I wanted to work with both. And so as an intern, you don't get 2, but you can, if you have an interest, you can, look, when you interview, they'll take that into account. You wouldn't get 2 supervisors. But that doesn't mean that you wouldn't have the opportunity to precept with other supervisors. So even if there are supervisors in child and adolescent psychiatry who don't have an intern, you could still spend time with them and have that experience. Yep.
Thank you. And one more question. This might be a little specific to the specific field placement you're in, but for those of us interested in utilizing a secondary language, could you speak a little bit about maybe the Spanish-speaking population or beyond, and if students need to display a certain level in a certain language to be a part of that care?
So clearly in a healthcare setting, you work with lots of different populations, and many experiences of working with patients and families that are using a different language than English. And so that's definitely something that comes up. There are medical interpreters that have designated training around medical interpretation. And so as social workers, and I'm pointing to myself, though I only know a few Spanish words, we cannot be translating for patients and families. But there are students that have been able to use their second language to be able to communicate with families. It's just making sure staying kind of within that lane. I have never known of students needing to get a certification to be able to use that other language. Does anybody know of that? I think it's one of those like you go in and use English and we're not testing you for that. So I think that a second language can be used within the work that you do, but not as a means to translate for a patient any medical information or to translate for families. Even when somebody speaks another language, if they are not the identified person certified to do that work, they need to have another translator come in to be able to provide that service. Does that help answer? Anybody have any differing thoughts or comments about that? Okay. Oh, okay, sure.
So just speaking from my experience, I'll say, first of all, it's wonderful if you have language skills and can use and can speak another language. I will say that it does sometimes open up a different dynamic with the patient and family that you're working with, because they view you differently as somebody that speaks their language than they do the rest of their healthcare team. And I've found with students that sometimes it's challenging to maintain your role identity because of the way you're viewed as somebody who speaks the language, if that makes any sense.
So it's not an absolute no, but it's a proceed with caution. Talk with a field instructor in your placement, again, no matter where you are, Michigan Medicine or elsewhere, and be really thoughtful about the use of that. But yes, I mean, to have that skill is a tremendous gift for sure. And it can bring a lot of comfort to patients and families. Absolutely. Yeah. Great.
Hello, hi, I'm Nikki. My friend and I are both in a special program, the New Leaders in African-Centered Social Work. And I was just wondering if you guys had any opportunities or what opportunities you offered that, because within our requirements, it requires us to work, Black African-American populations. I was just making sure I got the wording right, but if you had any opportunities, if you could speak to that.
Oh, Leo, I thought you were getting up to talk. No, that's okay. Generally speaking, the answer is not likely to be a scholarship program that can work at Michigan Medicine because it's not, we can't guarantee that meeting those requirements of that scholarship. I think like the placement that Leo's in, probably that could be. But I do not believe that they are offering another placement because Leo is there with them right now. Yeah. So, Amy, do you have any other thoughts about that? I would suggest, I forget who's in charge of that scholarship program. Is it Stacy? It's not an easy yes, is what we would say. And so if it's something that you're really interested in, you want to explore, sounds like one of our colleagues in Office of Field Education is connected to that scholarship, so we could talk with her and see if there could be opportunity. We'd love to be able to explore that. But for any of those scholarship programs, you do have to meet within those parameters of the scholarship. So we would need to make certain that that was the case. And I think while Michigan Medicine certainly works with patient populations from all over, the percentage of different ethnicities in that may not be necessarily guaranteed. So I think that is the challenge with that particular scholarship. But we're totally happy to explore that if it's something that you're interested in.
If it could be, that would be great. Should I grab one of your emails before we?
Sure.
Okay,
Yeah.
Thank you.
Yeah, absolutely. Other? Yes.
My question is for Martin. I'm wondering if you have any guidance for crafting a goal statement that highlights kind of readiness for a psychotherapy-based placement.
Yeah, I would say that we're really looking for people who have a specific goal of training as a psychotherapist. So we would want to see some reflection as to how you had arrived at that as something that you want to pursue. And, you know, it can be a little bit tricky because it does often lead into a more kind of personal aspect of someone's life. And so I would suggest that you want to, and I think like, Amy pointed out to this in one of her comments, that this is something where you want to find a balance between being, open, forthcoming, direct, and also not oversharing about your own experience. But I would say we're really looking for people who are psychologically minded and thoughtful and able to take a look at themselves. So being to some degree personal and how you talk about that path would be helpful.
Hi, thank you guys so much. I'm gonna put you right back on the spot. I'm so sorry. I was just looking kind of into the far future. I know you talked about those post-grad opportunities as well. Is that another application process that would be highly selective?
Yeah, I would say it is quite selective and that there tends to be a lot of interest in those fellowships. I would say though that, not to be discouraged about pursuing that as a goal if that's something that sounds like would be a good fit for you. That people who are interns in our program are often at something of an advantage in applying for a fellowship like that because they're already inside of our system. And generally, if this is something that you're passionate about, you should pursue your passion and you're going to wind up somewhere good, regardless. But our fellowship program is definitely one of the best ways to get further, more intensive training.
Thank you so much.
Any other questions? All right. Well, thank you all. Were there any from online, Amy, or have you been answering along? Okay. Okay. Excellent. Thank you all so much for coming. I want to thank my colleagues from Michigan Medicine for taking the time to come out here as well. And if there are questions, you can connect with us in the Office of Field Education, but please, again, pay attention to those deadlines for these applications. Should you decide not to move forward with Michigan Medicine, there would be nothing that you need to do. You just would complete your field application when the general field applications open. But again, make sure to complete that Google Doc if you want to move forward with Michigan Medicine. All right. Have a wonderful evening. Thanks so much. Thank you.